genetically, if there's a predisposition for breast cancer in a family, at what age should somebody really look at it? And if there's not a genetic predisposition, at what age possibly should somebody look at screening? Or is screening something that should always be done, doctor? You tell me.
Current recommendations are really to start at 40. If you have a breast cancer in your family, your mother, grandmother, potentially siblings, absolutely, then yes, going earlier, even starting at the age of 25 or 18, just depending upon, the real schematics of it, I suppose. But really the age of 40 should be the first mammogram. And then, could you go every 2 years at that point? You could. With the every other year recommendation of mammograms that came out several years ago, I've always continued to give that recommendation of going every year. 12 months can turn into 14 months very easily, and so why not give them the recommendation of every year? I also still recommend self-surveillance. Why not be aware of your body and what's happening? That was the way that I was diagnosed. I knew something was wrong. I didn't pay attention to it for a while, and so my experience was a bit different. If I would have paid attention to what was happening with me, if I was quiet, if I would have breathed maybe for an extra second, I would have perhaps gone a little bit earlier. But I think, so at the age of 40, I guess to answer your question, earlier if needed, as young as 18 or 20 depending. If you have a lesion that you're feeling, do you need a mammogram or an ultrasound or some other type of diagnostic study to be performed?